Welcome to this special event to discuss the Rohingya refugee crisis. I'm Anne-Marie Gray, the Executive Director and CEO of USA for UNHCR. I hope that this finds you safe and well. Today, we have donors, supporters, and compassionate Americans from every corner of the country participating in our briefing. I'd like to start by acknowledging you. Thank you for your caring for the well-being of refugees and for being on this call to recognize their strength and resilience. The UN describes the Rohingya people as the most persecuted minority in the world. Almost exactly 3 years ago, hundreds of thousands of Rohingya families were forced to flee their homes due to extreme violence in Myanmar's conflict-stricken Rakhine state. Most endured perilous journeys on foot, crossing the border into southeast Bangladesh, where over 750,000 people have sought refuge. In February of this year, just before the pandemic grounded us all, I traveled with a small team to Bangladesh, where I met some of these resilient families and the UNHCR staff who are empowering them to rebuild their lives. There, I had the pleasure of catching up with Steve Corliss, UNHCR's representative in Bangladesh since early 2019. Steve is heading up the operations there, managing what is a very complex situation. We're fortunate to be joined by Steve today for a direct report from Bangladesh and his perspective on the situation there. I thank you all for sending in your questions. Our format today will be, I'll just be raising some of these questions with Steve, and then I'll switch gears to ensure that we can get some of the audience questions, as I know that there are many that have been submitted. So let's get started. Hi, Steve, how are you doing?
Good evening. Nice to see you again.
Yes. Steve, a lot's happened since I saw you in Bangladesh this past February. COVID, which was just starting in Asia. I think we were having temperature checks as we arrived. COVID's been very much top of mind, but I'm wondering if you could start by sharing some of the context of what life was like for the Rohingya refugees living in Bangladesh earlier this year. What was going on? What were the number of people there, their living environments, and the challenges and opportunities?
Well, I think, Anne-Marie, when you were here, you must have been impressed by the vastness of the refugee camp. And when people see it for the first time, if you've never been to a refugee camp, I think you might be overwhelmed a bit by the crowding, looking at people in bamboo and plastic sheeting shelters, seemingly not very comfortable in their living circumstances. But if you have more seasoned eyes, I think, and you've been around to refugee situations, what you actually would find it to be is a very well-organized, orderly, and I think very importantly, a peaceful and a calm camp without that sense of desperation that you might have expected. Now, it's not that life is easy. People are really struggling, but in Bangladesh, they have a sense of security that was really totally lacking for them when they were in Myanmar. I call it freedom within constraints. They're not allowed to move outside the boundaries of the camp. They're not allowed to do many things. They can't have jobs, they can't work, but they were actually under so much threat and risk at home that they feel quite relaxed. Now, it was nothing short of a miracle what happened here in 2017. UNHCR and the government have now registered 860,000 Rohingya refugees. They live in a very small, congested area, but 740,000 of those people arrived within just a few weeks. And when they arrived, they entered a forest reserve. These were sandy, unstable hillsides with nothing, absolutely nothing. And by the time I arrived for the first time, which was December 2018, and I formally took up my post in January of 2019, it had really been transformed already into a functioning city, in effect. So the question now, though, I think, is how do people see their lives? That sense of relief and safety, especially with COVID, gives way to a greater sense of uncertainty. What's next for us? And I just would say that nobody should be a refugee forever. And the refugees very much want to go home. They see themselves as people of Myanmar. That's their home, and that's where they want to go. But right now, that's very difficult because of the conflict that continues on the other side of the border.
And you talk about them going home, but in fact, the Rohingya also represent a large population of stateless people. Their citizenship is, there is no citizenship in Myanmar.
Yeah. Now that's because citizenship or statelessness is in the eye of the beholder, and the beholder is the government of the country. And the government of Myanmar says that they are not citizens, but they have actually lived in Myanmar for generations. It was until in 1982 that Myanmar changed its citizenship law and deprived the Rohingya of their nationality. And this is really the underlying problem for the Rohingya. They have the lack of belonging. They have a sense of identity as a people, but they have that sense of exclusion from the body politic of Myanmar. And so this is one of the things that they really ask for. They ask for a pathway to citizenship in the country of their birth, their parents' birth, their grandparents' birth, and sometimes many, many generations back.
Yeah. So now we find ourselves with the additional threat of COVID-19, and Rohingya refugees and refugees around the world are even more vulnerable than they were before. I want to say thanks to our very generous support of our donors, and other donors around the world. UNHCR and humanitarian partners have been able to rise and scale up very quickly their activities to address COVID-19. Can you give us a glimpse of what's been happening in the camps in Bangladesh? What have been the response to the pandemic? Many of our donors have been moved to give to ensure that UNHCR and community health workers are prepared. Share with us a little bit about what the activities have been in the camps.
Well, first of all, let me thank each and every one of the people who are listening in today for their support and the way they make it possible for us to respond. Really, when I right after you were here, I was in Geneva for a few days to launch our appeal for the Rohingya humanitarian crisis. And when I returned, I think we all felt we were looking into the abyss. We saw what was happening in Italy, then later on in other parts of Europe, and then on to North America. And we were extremely concerned how the pandemic would hit in a refugee camp where people were living in such congested conditions. We made a fairly radical decision together with the government early on to reduce the humanitarian presence in the camp, the number of humanitarian workers going to the camp by 80%. By 80%. That doesn't mean we suspended all of our activities, but we moved to critical activities only. Then we moved very quickly to establish a strengthened healthcare response. Mm-hmm. So UNHCR in early March started building what we call a severe acute respiratory infection isolation and treatment center. And really we took a vacant lot and transformed it into a functioning hospital in about 5 weeks, and then built a second facility inside the camp. And I think the most important thing to say is that all of our facilities are equally available to the Rohingya and to the local Bangladeshis. And this is important because a virus doesn't discriminate. If you can't treat public health problems by discriminating between different communities. But it's also very important for the local Bangladeshis who've borne an incredible responsibility hosting the refugees to see something coming to them as a result of the Rohingya presence. So this was extremely important. Also, you go through the camp now and you see literally tens of thousands, 40, 50,000 hand washing points, so that people can observe good hand hygiene. We built new latrines with the funding that's been provided, bathing facilities. We've distributed soap. I just signed a contract this evening for the distribution of soap within the camp. Hygiene so that people have what they need to stay clean. But what I really want to emphasize, and this is where I'll come back to the community health workers, the most important investment we're making is less tangible. You can only go so far to mitigate and protect people and even treat them treat them when they suffer from COVID-19 illness. Information is the first line of defense. And this is where the community health workers come in, giving the Rohingya what the information they need to keep themselves and their families safe. As I said, good hand hygiene, physical distancing, recognizing symptoms, knowing where to go for treatment, the sort of things that you talk about every day today in the United States. And this has been challenging because there is no internet in the camp for the past year by government policy. So we have to go with the traditional forms of communication, posters, door-to-door communication with people, loudspeakers carried on people's back through the camp, small vehicles with very, very large speakers on them, just to get the word out to people. And the community health workers I want to mention again, because this is an extremely well-developed mechanism that we now have, dividing the camp into sectors, having those health workers know the people in their sectors, visiting by a community health worker, so we know who is suffering from COVID symptoms, and to make sure they are able to get the treatment that they need.
Yeah. I was so impressed when I traveled into the camps to meet with some of the community health workers. Often I saw young Rohingya teenage women, young women who had been trained up to be able to provide a referral service to clinics. They were literally, as you said, going door to door, hut to hut. Not only were they beginning to roll out the COVID kind of training and awareness programs, but they're often the front line. And we interviewed some of these young women, and I asked them what they were most proud about. And it was really, they said they felt that they were contributing to the bringing forward their own people. And I just thought that was such a remarkable statement, that they felt for the first time they had an active role in forming and supporting their communities. And that's one of the reasons that we've really looked at the community health worker programs as being a way we can direct some of the US funding. So I thank you for that example. Tell me a little bit more about what's happening and what you, now that COVID is with us for a while, what more are we doing kind of at the community level to build and foster a sense of community amongst the Rohingya?
So I'd really like to pick up a little bit on what you had said about the community health workers. The role of the volunteers, the Rohingya volunteers in the response, is extraordinarily important. I really have been with Unhcr now for more than 3 decades, and we have certain truisms. We always say that refugees are at the center of the response, but I have never seen an operation where refugees play such an integral role in delivering the operation. We really involve the Rohingya in every aspect of the response. They are community outreach volunteers. We have men who are actually role models for the prevention of sexual and gender-based violence. They actually go out into the community to talk about the importance of respecting women and making sure that women in the home are safe. They're health workers, as you've already described. They participate in building roads. They participate in all the cleaning of sanitary facilities in the camp. Now, this is extremely important for several reasons. First of all, they get a small stipend for the work that they do, and this helps families bridge the gap between what we can give them in kind assistance, food and these things, and what they actually need to survive. And it's also essential because we have 860,000 people to take care of. So they have to be involved in helping to take care of themselves. But I want to come back to the word that you use, pride, and I'll also use the word dignity. They have a reason to get up in the morning. And they have a position of respect and responsibility in their communities. And this is something that few Rohingya actually were able to experience when they were living in Myanmar. And it's one of the reasons that I mentioned earlier, there's a sense of calm and peace in the camp and smiles on people's faces because they feel a part of something. And for the first time, they've been able to associate, relate to each other as a community, and to play a role. Now, the idea of community health workers and other volunteers was really strategic for us. It was about sustainability, because in any humanitarian emergency, you may be well funded in the first year, you may be well funded in the second year. If you're lucky, you receive good funding in the third year, but eventually other things come up. COVID comes up. There's this horrible, horrible bombing in Beirut where people are now really focusing their attention. And if you don't put in place the elements of sustainability so that a community can help take care of itself, you have a very hard time going forward. Now, in this situation with COVID, we've had to accelerate that quite a bit. As I mentioned earlier, 80% of the humanitarian workers are out of the camp. They're working, they're not sitting at home doing nothing, but they're working remotely. And how they're working remotely is in contact and in coordination with the refugee volunteers on the ground. So whereas in child protection, for example, previously an international officer or a Bangladeshi specialist in protection would be handling a particular kind of case, now we're actually having to rely on the Rohingya refugees to assume greater responsibilities.
And that's a good thing. I mean,
That's
that is a lasting a lasting there's a lasting effect there, which is so important. I mean, we were there at the beginning of the COVID crisis, not in Bangladesh, but we were certainly seeing borders start to shut down. Certainly on my trip back from Bangladesh, it was a lot longer than I anticipated, with a lot more temperature checks. But there were some other core programs beyond the health programs that I was able to see. I spent a lot of time in elementary schools and in a vocational training school for women. What I was so impressed with was the approach was to have a Bangladeshi teacher, a host community teacher, with a Rohingya teacher together teaching in the Rohingya language. But what's happening now with those children that I saw in school? Have those programs been shut down? And what might be the plans for, how you approach the next 6 to 12 months?
Well, it's absolutely the same situation that you're experiencing in the United States. I see on the news the UK is also grappling with this. When COVID hit, the Bangladesh schools were shut down. And at exactly that moment, the Bangladesh government suspended the learning activities in the learning centers in the camp. But not only the learning centers, but really any programs that brought large numbers of people together for all of the reasons that we know to avoid the spread of the virus. I mentioned earlier the protection implications of that, because if children are not coming to school or what we call child-friendly spaces, and the counselors and the teachers are not noticing things that might be happening to them at home. So actually the number of reported instances of child abuse and child rights violations has decreased. That's not because those incidents have reduced, but because the reporting has reduced. So it is extremely concerning. We had a really important development here in January, where the government of Bangladesh agreed to the introduction of the Myanmar national curriculum in the camps.
Yeah.
This is normally UNHCR would want to have the education of refugees in the language of the country of asylum and according to the national curriculum. That's sort of the gold standard. But there are particular political considerations in Bangladesh about the identity of the Rohingya people that meant the government would not want that education to take place in the Bangla language or in the national curriculum. But also the Rohingya refugees themselves asked us for education in the Myanmar national curriculum. So we were in the process of standing up a pilot that would put 10,000 children in grades 6 to 9 into the Myanmar education program. And then at the beginning of 2021, we were going to expand it to grade 10 and introduce grade 1. This has slowed down, to be frank. We have not been able to put the children back in school, but we're trying our best to continue, as most families are at home, by supporting home-based education. This is not perfect because parents often are not really patient enough sometimes, I can say from my own experience, or sometimes don't have the skills they need to educate. But we are trying through use of technology, also education through radio. But there is a real imperative to get the children back to school. And as soon as we have a clear idea of how the pandemic is unfolding in the camp, we will press the envelope as much as we safely can to get children back to school and continue with the implementation of the Myanmar curriculum pilot.
Yeah, I mean, it's just so critical to not lose, you've made progress. You don't want that to go backwards. And it must be extremely difficult, particularly you indicated, earlier that the internet, certainly when I was there was no internet in the camps, which was disturbing to say the least. But other than the radio transmission, you talked about technology, it must be very, very hard.
Well, we have had indications that the government is strongly moving toward the restoration of the internet. Mm-hmm. We wonder when that will happen. We keep seeking clarification on that because it has a lot of implications. it would be very helpful for education because we can use online education. We want the kids to learn Myanmar language. There are not teachers of Myanmar language in large numbers in the camp. We're going to have to use technology to reach them. Even for COVID-19, as I mentioned earlier, health messages are being disseminated by refugee volunteers walking through the hills of the camp with a battery pack and a loudspeaker, giving those messages out. We could communicate much more efficiently if we had internet access. So this is one of the very important points we've made in our advocacy with the government of Bangladesh. And we hope that the internet should be restored in the coming weeks.
I was also very lucky to see some of the environmental programs that have happened in the camp, the great success with the cook stoves, the Clean Cook Stove Initiative, the use of the LPG gas instead of firewood. Our listeners might not be aware that this was actually part of this camp was actually a wildlife preserve in Bangladesh, and a place where the Asian elephants, this is not what I expected to see on the trip. So usually we don't have animal sightings, but this is actually an area where the Asian elephants have that kind of genetically programmed route that they take between Myanmar and Bangladesh. But the area in which the camps have been built has been decimated because, of course, when people arrive, they need firewood. So it was a terrific, it was such a positive thing to see the impact that the LPG program has had. And we saw reforestation programs, water reclamation programs. I mean, really hats off to UNHCR and the implementing partners for this work. Many of our callers are very, very interested in what we do through the climate change lens.
Yes.
Do you want to talk a little bit about that program and how important it's been?
Yeah. Now, we do have drone footage of the camp, and I think even satellite imagery that shows the period from August 2017 through about November. And it's stunning to see an area that's green and lush and verdant. There was deforestation already in Bangladesh, but within that sort of 2.5 to 3 month period, the hills turn from green to brown. Yeah. And I get disturbed sometimes when those photos from 2017 and 2018 remain the image that stays with people, because we made a tremendous effort on both counts, as you said, to have the full introduction of liquefied petroleum gas, LPG, as a cooking fuel in the camp. We're introducing pressure cookers as a way to conserve fuel, and you can reduce the cost and make that program more sustainable. And we're engaged in large-scale planting as part of the Bond Challenge to reforest areas that have been suffering from deforestation. And the camp today, if you visit, is extremely green. It's not environmentally restored, but we do a lot of planting with native species. And the camp is a different place than it was even when I arrived. You can just see a tremendous growth. And the land here is very fertile. I mean, it's very warm. We have a lot of rain. And so the reforestation has been considerable. But 200,000 refugee families are on LPG, and a significant number, most of the host community are as well. That is a program that needs to be sustained. In the host community, we try to introduce we distribute at first and try to get the host communities who have more means to begin purchasing the LPG on their own. When COVID started, I was extremely concerned that if our supply chains were broken, if our distribution ceased, then we would not be able to sustain that, and we would reverse the gains made. But so far, we've been able to keep the programs going. I could say a few things about the elephants if
that would be great. I mean, that was just such an unintended surprise from this trip.
So this, as you said, a lot of the migratory routes of the wild Asian elephants, which travel between Myanmar and Bangladesh, have been cut off over the years. There was one remaining route that now found the city of refugees right in the way. So we've worked with partners, including the International Union for the Conservation of Nature, to have elephant deconfliction programs. And I mean, they're really astounding. They build almost life-size stuffed elephants that are actually beautifully embroidered, and the people carry them and they practice dissuading the elephants from entering the populated area. There are over 90 elephant watchtowers that are staffed by volunteers, and I think one of the most important things is this brings the host community and the Rohingya together. This is something that they work on together because it's a shared issue. But I have to say, it's one of the things that made me most sad when I came here. I'm a life career humanitarian, so I'm here because I care about people. But seeing the disruption of the elephant migration routes, where there's probably so few of them left. There are only 35 to 40, I think, wild elephants living in that area. But it's necessary. The deconflicting is necessary. We've actually had elephant encounters that have resulted in the death of refugees when they've intruded into the camp.
Yeah, I think we saw there were about 97 of the towers. I was lucky enough to meet with about a dozen of the young men, teenagers often, that man the towers overnight. And I just to make sure our listeners are aware, dissuading them with flashlights, torches, and
banging on pots and pans.
Yeah. No animals were harmed in the in this, but it really was quite a remarkable program. And again, the issues of pride and dignity that people are there. The young men that we met that are volunteers are like, I am doing something to protect my community, but I'm also helping the environment. So I was really surprised with that program. It's not often you walk away surprised, as you said, those of us that have traveled and worked in the field. So great program.
In the Rohingya language, as I understand it, the word that they use for the elephants is Mao, which means uncle.
Yeah.
So they have a heartfelt sense of responsibility for the elephants, and they feel that sense of pride that you've mentioned in taking care of them.
Moving beyond COVID and the programs we've seen, ultimately we know that many Rohingya refugees want to return to Myanmar when they can do so voluntarily and in safety and dignity, and they want to stay at home when they get there. Can you talk a little bit about what it would take to make that possible?
Sure. It always takes political will. Some governments very generously have built houses and new villages, but what Rohingya refugees tell us is they will go home with the same shirt that they were wearing the day they arrived in Myanmar, in Bangladesh from Myanmar, if they know that they and their children will be safe. So what they're really looking for is security as a foundation, but also signs of change in Myanmar. There are still perhaps 500 or 600,000 Rohingya living in Rakhine State, much smaller than the number who are outside. And they're under very serious restrictions of freedom of movement. They're unable to exercise livelihoods. They're unable to access basic services. A significant number of Rohingya who were displaced internally in Myanmar remain in internally displaced person camps that are not where the conditions are not good. And the refugees in Bangladesh are well aware of that, and they are looking for a sign that something is changing. And importantly, as I said before, they consider Myanmar to be their country. They want to belong to Myanmar, so they're looking for what we call a pathway to citizenship, which is a predictable process that will allow them to claim the citizenship of the country of their birth. Mm-hmm. We've also called, and the High Commissioner Filippo Grandi recently spoke to the Security Council, and he called for dialogue. And we saw something very encouraging in July last year. Very senior Myanmar officials came to Bangladesh. They met with the Rohingya refugees, and it was brave, I think, on both sides, for both sides to enter Myanmar authorities to sit and face the refugees, and for the refugees to face the Myanmar authorities. And I have to say, the Rohingya refugees behaved with a lot of composure and made their case. And at the end of the these meetings, they didn't agree on return, but they agreed to keep talking. And unfortunately, some of the developments that followed disrupted those communications, and that really has to resume. Rohingya have to be actors in any process that's going to lead to their repatriation. It cannot be something that's decided for them by UNHCR or the government of Bangladesh or the government of Myanmar or other governments that are interested in the situation. And they are looking for signs that would allow them to have trust and confidence. And why? Because it's not the first time that Rohingya refugees have come to Bangladesh. They came in 1978. About 250, 300,000 people. They went home again. In 1991, they came and they went home again. As I mentioned, in 2012, there was violence that uprooted many. In 2016, 80,000 came here. And in 2017, most of the Rohingya who remain in Myanmar came here. But each time they went home with fewer rights, less status, and no fundamental resolution of the problems that they were facing. So I think it's something that we have a clear understanding with the government of Bangladesh that they should go home voluntarily and in safety and in dignity, as you said, but sustainably, because it's very important that this is the last time that Rohingya feel compelled to come to Bangladesh. And going home, it's not a logistics exercise. You were in the camp, Anne-Marie, and you know at the high points of the camp, you look into the distance and you see Myanmar. You see the hills. That's home. It's so close. And if they're not going, they have very good reasons. And it's not because life in the camp is easy. Life in the camp, it's better than where they were, but it's not easy at all. So it's all about peace, security, trust, respect for identity, and a sense of inclusion in the society.
Can you share with us, Steve, a little bit about the unique role that UNHCR plays in trying to negotiate a safe return, not necessarily for the Rohingya, I think you've outlined that, but UNHCR is really quite unique in the role that it plays in safe return. Can you talk a little bit about what that process is?
Sure. Well, the first thing to say is it's never easy and it's never perfect. And I don't think refugees expect perfect to go home. They know that they're going to have to rebuild their lives. But UNHCR plays a very important intermediary role. And I've done this in different parts of the world. I could give as an example Tanzania, where we organized tripartite agreements. By the tripartite means country of asylum, Tanzania, country of origin, in that case, Burundi and the Democratic Republic of Congo, and UNHCR. And we get people around the table and we begin talking about the refugee population. We try to move it into we have a technical working group, and we try to really talk about the practicalities of going home, what it will take to convince people to go home, what would the mechanics be. But all of that has to be shaped by a political process that makes it possible. And we feel that we're a kind of honest broker. We have principles and a framework for how repatriation should take place. And we try to then be supportive. The other thing we do, which I think is very important, and we do it here in Bangladesh, is registration. We, as I said earlier, have registered with the government 860,000 refugees. So we have their basic biodata. We know where they're from in Myanmar. We have information on their family links. We have information on their socioeconomic profile that could help us with reintegration planning. And we take their biometrics. So people present 10 fingerprints and 2 irises. And we have a very sophisticated, well-protected, very high data protection, data integrity standards. But what that means is the identities of people who may not be accepted by Myanmar as their own citizens are secured. They're secured as the group of refugees who came from Myanmar to Bangladesh, and they have identity documentation which they may never have had in their life. And going forward, these are immutable characteristics. So we hope that it won't take a long time, but even if it were 5 or 10 years later, we'll still be able to verify the identity of the people when we first came into contact with them, and we'll be able to strongly say to the 2 governments that these are people who are refugees from Myanmar and have the right to return.
Mm-hmm. Thank you. In spite of the ongoing violence and horrific circumstances, the Rohingya refugee crisis has not received kind of the constant attention we believe it needs and deserves. A recent survey of Americans suggests that the Rohingya crisis ranks lowest on the list of refugee crises that Americans have sought information about. At the same time, we know that the US government have been generous contributors to UNHCR's work in Bangladesh. And American donors, we hope through briefings like this, will continue to learn and inquire more about the Rohingya situation. So thank you, Steve, so much for answering the formal questions at the top of the program. We wanted to feed in some questions that our listeners have submitted today. The first question is from Poppy, who is watching us, and how many, and many of our caring supporters have asked this question: what can Americans do to help?
Okay, thank you. And thank you, Poppy, for the question. And the first thing I want to say is to repeat what Anne-Marie has already said. Americans already do so much. The United States is by far the largest contributor to UNHCR's work globally, and I'm talking in financial terms. It's also the largest contributor to our work here in Bangladesh, but the US government's role has so much more importance. I work very closely with the United States Embassy in Dhaka, with the US Ambassador, Earl Miller, and his team, and they're a tremendous support, a source of support for our work. But maybe just more personally, I'll mention that I started out my UNHCR career in 1987, sponsored by the United States State Department as a junior professional officer. So here I am 33 years later, still working with UNHCR because the US government gave me that opportunity. But I want to say that that global leadership that the United States demonstrates, even when refugee issues, as we know, have become complex and politicized, particularly at home, remains steadfast. Refugee communities stand up for their own people, of course, who are still in refugee camps abroad. But there are very few Rohingya, I think, relatively speaking, in the United States. But refugee communities stand up for each other. So you find that an Ethiopian refugee organization or others who've now been in the United States for quite a long time, we know that refugees are now elected members of Congress. Regular Americans are making their voices heard. And in a time when bipartisan issues are very few, issues that enjoy bipartisan support are very few, refugees is one of the places where we have support on both sides of the aisle in Congress. And I just want to say that how can Americans help? Well, we are a democracy. Your voice counts. When you speak to your Congress people and you let them know that this is something that's important to you, that matters. That matters, so that when the budgets are decided, when eventually resettlement places are allocated, and we don't have resettlement from Bangladesh now, but it could be a feature of a solution strategy in the future. Your mobilization and your contacts at the community grassroots level and through your elected representatives is extremely important. It does make a difference.
Yeah, thank you. And I'd urge listeners and watchers to look at unrefugees.org and look at our advocacy center for questions you can put to any official that is running for election on the refugee issues and other ways in which you can engage. We have a question from Jessica, Steve. What advice, I get this one a lot, what advice would you give to someone who wants to work with and for refugees in the future?
Well, the first thing I'd say, Jessica, is that I was in your shoes. I was in your shoes a long time ago. I was always interested in refugees, and I'm going to scare everybody with my advanced age, but I first walked in to a UNHCR office in Bangkok, Thailand in 1982, and somebody was kind enough to sit me down and talk to me about UNHCR's work. It was another 5 years before I actually entered the organization. But I think making those contacts and trying to learn about the field is perhaps the most important thing. Refugees are everywhere in the United States in the most unexpected places. There are refugees in Lewiston, Maine. There are refugees in Fargo, North Dakota, there are refugees in Minneapolis, there are refugees everywhere, and there are refugee community organizations. So there are plenty of opportunities to learn about the issues and get to know the refugee communities and see how you can help asylum seekers, also people who have not yet been able to obtain refugee status, and create that history of engagement with the issues. I think it's extremely important. And then I guess I would say when you're ready, take a risk, look for opportunities, try to work abroad. There are non-government, UN is sometimes hard to enter. Everybody has their own story of how they found their way into the United Nations. But there are great non-governmental organizations that I can mention, like the International Rescue Committee, Save the Children, World Vision, that give opportunities to young people so that they can get experience, because it's that first bit of experience, whether in the United States or abroad as a volunteer or in your first temporary position, that creates that track record, and you just have to build that up and find your way. But what I can say is, if you are committed and you decide that that's what you want, you won't be dissuaded. And that's how it was for me. I had every reason not to succeed, and people certainly told me I wouldn't. And I had, when I joined UNHCR, I had just graduated from law school, and I had my debt, and I had a lot of other concerns, and I joined UNHCR directly from law school, and I was
Which law
glad I
school
did.
again?
I'm from Michigan. I went to the University
Yeah.
of Michigan Law School.
Yeah.
And even when UNHCR didn't love me back after 2 years in 1990, they were shrinking, they weren't hiring. I
Yeah.
went back, I practiced law in Washington for 3 years,
Yeah.
and then I rejoined UNHCR during the war in Bosnia. And so now I've continuously been in UNHCR since 1994. And
My dad went to the
unfortunately,
same law school, so I knew the answer before.
okay. Okay. And maybe if I could say one more thing to Jessica, languages. English is sort of the Microsoft of languages. People will do you constantly the favor as you travel the world of speaking English to you. Sometimes I feel embarrassed and privileged in a UNHCR meeting with 21 people. Everyone has their 20 different native languages, and everybody's speaking English for my benefit. But learn languages. Spanish and French are very important. Arabic, if you speak Arabic, it's
Very
a
important.
phenomenally important
Yeah.
language for UNHCR. Languages will broaden your horizons and increase your possibilities for employment.
Thank you, Steve. I want to thank you for joining us today. I really appreciate your dedication, your family's dedication. I know that you are flying home tonight for the first time in 6 months to be with your family. Thank you for giving us your time today and giving a voice today to the Rohingya refugee crisis. I'd like to thank everyone who has been watching and spending some time with us today and learning more about the courage, tenacity, and resilience of Rohingya refugees. We are launching an appeal specifically to assist in the work that Steve is leading in Bangladesh on behalf of the Rohingya. We're also focusing a small part of that campaign on supporting community health workers, the young men,
Yes.
the women, the volunteers that are really the frontline workers in this crisis in that setting. In times like this, it's so important that we look out for each other. It's what it means to be American. We are kind, generous people. We believe in helping others. Thank you for showing solidarity. Thank you for helping to lift up and celebrate the voices and stories of refugees, particularly the Rohingya, who have survived so much. They are indeed vulnerable, but they're also incredibly resilient and hopeful. Thank you for standing with us and with refugees at this critical time. Please stay at home, wash your hands, take care.
Thank you all.